I'm Kasra Ahmadinia. I'm an orthopedic spine surgeon here at Advanced Orthopedics in Tulsa, Oklahoma. Today we're going to talk about the SI joint and the pathology that can affect the SI joint and a source of back pain for patients that has often been overlooked. So the SI joint itself is what I tell patients where your pelvis and your spine come together. My practice consists mostly of patients coming in for issues regarding their lumbar spine or low back pain in general. And we've started to notice about 15% or so of these patients actually have source of back pain that's not from their lumbar spine. And as we started to dig in a little further, you notice that the pain is coming actually from their SI joint. So the patients that come in that we think may have SI pain are usually the folks that we look at other areas in their back and in their hips and we can't really figure out a source of their back pain. And they've been having this low back pain that no one's really been able to diagnose or treat. Those are the patients that we start looking into, is the SI joint a possible source of their pain? And the way we do that is multifold. First, you want to listen to the patient, get their history, make sure that their pain kind of relates to what you would expect someone with SI pathology to have. One of the questions we always ask patients is, where is your pain? And a lot of times the patient will take one finger and they'll point to the exact location of the pain. And that's pretty specific for SI joint pain. And the patients are usually sitting off of that pelvis. They're kind of tilted off to the side because it hurts them to sit there. And they sometimes have difficulty getting in and out of a chair as well, because when they have to lift up to get out of the chair, that moves their pelvis and they start having pain. The patient can walk around oftentimes with a limp in their leg or even dragging their foot, and usually that kind of hones us into the diagnosis of an SI joint pathology. After we get the history and I start thinking that may be a source, our physical exam findings will kind of hone that in. There's 4 or 5 exam findings that we try to elicit in terms of patients with SI pain. Once we're pretty confident that this is the source, we still want to get advanced imaging to rule out anything else to do with their back or their hip. And then we oftentimes will send them for an injection. I use the injection as not only a diagnostic but also a therapeutic option. If they got temporary relief of their pain, enough for me to be able to say, okay, that's the source, but they continue to have the pain even after the injection, we oftentimes send them to physical therapy. Once we decide the patient is a surgical candidate, they've failed the conservative treatments, the next option we often offer them is surgical intervention. The way that works is we bring the X-ray machine in to help locate our bony landmarks. And once the bony landmarks are all identified, use the X-ray to advance a guide wire through the bone from the pelvis into the SI joint. Once we have our guide wires in place, we're inserting our implants. The implant that I typically use is the iFuse 3D triangular implant. The reason why I use that one in particular is because we're trying to get that bone to fuse together, the joint, to eliminate the motion. Because as you can imagine, if the rotation of the joint is this way and this way, it can still rotate around a circular screw. After about 2-3 weeks, we allow them to do full weight bearing. And so far, patients have done really well with this procedure and have been pretty satisfied. So if you are thinking that it might be your SI causing your low back pain, please come to Advanced Orthopedics and I'll be happy to see you and see if there's anything we can do to help your low back pain.